Hello, beautiful people, and welcome back to my channel. On this next video, we're gonna pick up where we left off with our, what was I even studying? I study all day long, okay? We're gonna pick up with the American Music Therapy Association professional competencies. I guess these are supposed to be the basic ones, and then, we have the advanced competencies also, keep that in mind. And I'm picking up where we left off at music therapy foundations and principles. So before I continue on, I'm just going to read you the legend. So as we know, the exam is multiple choice. And there are, from what I remember, I think most of the questions were out of 5. Like it was A, B, C, D, E. I think there were five choices. So anyway, so here's what we have for our legend just as a reference. We have number 1, referral. Okay, so we have 1A, referral. And then we have, sorry, I'm just trying to find how many questions. Here we go. Okay, so referral, there are 2 questions. This was on my exam, just to give you guys a reference. 2 questions. Then on 1B assessment, there were 20 questions. 1C, interpret assessment information and communication results. There were 3 questions. 1D, treatment planning, 15 questions. All right, this is the biggest section. 2A, implementation. That was 63 questions. So out of this whole exam, if you are studying this exam and you only have like 24 hours, I would say spend most of your time on the assessment portion and implementation. Okay, because that's like what majority of the exam is based out of. Next section is 2B, safety. That's 3 questions on the exam. 2C, termination and closure, is 4 questions. Documentation, 3A is 4. Evaluation, 3B is 6. 4A, professional development is 3. And then 4B, professional responsibilities, is 7 questions. Okay, so that's like how this exam is broken down by category. Like I said, assessment has the second most. Implementation has the most. 63 questions are based on implementation. 20 is based on assessment. The third most is treatment planning. Okay, those are like the 3 biggest sections if you only have like a short amount of time to study for this exam. I would spend most of your time in that department. And what this refers to actually is, and we're going to get into this in another video, but what this refers to is like when you print out your book. I'll try to get it here. When you print out your little book, like prior to taking the exam, it has like this little outline here. I'll kind of show you where it has like the examination content, and then the first section here is referral and assessment. So that's what this is primarily based on. However, all of the answers, like the reason why they chose answer A for the referral question, is again based on the competencies. So that's why we're going through the competencies first, just to let everybody know. Okay, so let's move on here. And I'm gonna actually type this stuff out as we go on my iPad. I was just reading it out the last time. Okay, so We left off at music therapy foundations and principles. I have all these sticky notes on top of my paper here. Actually, I'm going to type it on here. That will be much easier. And then I can look at you while I type. How lovely, right? All right, so music therapy. First one, existing music therapy methods, techniques, materials, equipment for appropriate application. Second one, here is principles and methods of music therapy: assessment, treatment, evaluation, termination of populations. Isn't that what we just talked about, people? Our lovely, lovely test is based on that second one. Psychological aspects of musical behavior. Then we have psychological aspects of physiological, that stupid word, aspects of musical experiences, including but not limited to central nervous system, psychomotor responses. All right, then we have physiological, physiological, and sociological basis of music therapy, use of current technologies in music therapy. Okay, so first of all, this has a lot going on. Second of all, the most important parts here, of course, are principles and methods of music therapy assessment. So I'm going to put that in here, and I'm just going to rephrase it a little bit. So we have methods, including, and I am going to keep this word for word just because that's the way the exam is written. They use assessment, treatment, evaluation, termination. And then we do see this yet again in another section here. We have technology. So methods. So I'm going to put here methods used and the use of technology in assessment, treatment, evaluation, termination. Then the other two that I wanted to talk about here was the physiological aspects. All right, and then we also have a basis of music as therapy in, and then we have physiological, physiological, and sociological. And the reason why I'm putting all of these here is, first of all, the main basis of the exam is based on the assessment, treatment, evaluation. We should actually I'm gonna put implementation in here because that's like the most important part of the exam, and then termination. And then I also put basis of music as therapy, and I listed physiological, psychological, sociological, and physiological. I think that was it. Okay. Moving on. Client assessment. Okay, so in this part, I'm going to put down, I almost fell off my this chair. I'm gonna make this one a different color because here we go. Here's where the exam is. So we have client assessment. All right. Then the next one is going to be select and implement effective cultural-based methods for assessing client strengths, needs, preferences, musical functioning, and development. Observe and record the client's response in assessment. Identify functional and inappropriate behaviors. Identify client's needs. Communicate assessment findings. Okay, so let's just sum this up right here. So Obviously, we're going to use effective methods to identify strengths, clients, to identify clients' strengths. And we're going to do needs, musical preferences, musical functioning, development. So before I move on from this section, first of all, when you assess a client, if you're lucky, you get like 30 minutes. I worked at my last facility that I worked at. I didn't get any assessment time at all. Okay. So like, if you're lucky, you get 30 minutes, if that. Okay. That's being like generous. So that being said, like, it's just like a first lesson, like when you have your first voice lesson or your first piano lesson, and here you are, never taken piano before, so you're obviously not gonna like show off, or the client definitely isn't gonna show off. Like, I remember I had so many clients that like during the assessment they wouldn't play at all because they were scared. They were scared because I'm a music therapist. Music is in my title. Like, I can't play for her. And to be honest, like, if I was a client and I was working with an art therapist, I'm really bad at art, by the way, I probably would do the same thing. I probably wouldn't want to work with them either, and I'd be scared to show off my talent. So in a real life assessment, you will not be able to record the musical functioning of the client. You will not be able to record the accuracy of their behaviors, because they're going to be either shy or they're going to be on their best behavior. What else? Yeah, and you'll be able to assess them and figure out a goal, but like, other staff members are probably going to tell you, oh, this client throws shoes, and like, the client's not going to be throwing shoes in your music therapy session, especially if you just play piano and there's no like instruments for them, so like, just keep that in mind in real life when you assess. But for the sake of this exam, you're supposed to be able to identify all of these things. Next is you have to record findings. I don't want to scare anybody. You're definitely going to be able to pull something out. Like, you're definitely going to be able to pull out a objective. It just might not be the objective that people want, or that people have mentioned. So we have record findings, and then record findings and assess. And then we have communicate. Assess, communicate with professionals. All right. Next one here is our treatment plan. All right, so we have create music therapy experiences for clients' objectives. No duh. Formulate goals and objectives, identify clients' primary treatment, provide estimates of frequency for treatment, select and adapt music, instruments, equipment, formulate music therapy strategies for individuals, create a physical environment, plan and sequence music therapy sessions, determine clients' appropriate music therapy group or individual placement, and then coordinate treatment plan with professionals. All right, just like last time, in the real music therapy world, goals usually last between 6 months to a year. So when you formulate the objectives, keep that in mind, like that you should have your goal lasting for 6 months to a year, because that's when the client assessment happens. Like, usually, if you're lucky, the facility will assess the client every month or every 3 months. But if you're working in a facility with a lot of different clients, they're not going to be able to assess each client that frequently. So the big assessments are 6 months and then a year. So every 6 months, like, they have an assessment. So when you create a goal, it's always good to make the goal for the goal is so that way you can achieve it in 6 months. And then at the 6-month mark, if the client does do well and they can improve, then you can say that at the meeting, oh, this client is doing well and they're gonna move on to this next goal. And this is our first objective we're gonna work on. Or if they're not improving, you can say, oh, client is not improving as fast as I would like them to, so I'm going to carry the goal out for longer. So that's just to base it on. Usually I came up with like 4 to 5 objectives for one goal. So then that way you had it was a little less than one objective a month, which is achievable for a client. Just to let you know, that's the basis of our goals, and that's the basis of our objectives, is based on a goal that's 6 months. Select and adapt musical instruments and equipment. I think that's an exam question, to adapt the equipment. That was something I did not learn about until my internship, because we were always doing like sessions with each other, and obviously everybody knew how to play an instrument, but adapting instruments and equipment happens a lot if you work in a hospital. Create a physical environment. That's also very important. That's also on the exam. And then determine the client's appropriateness for a group or individual placement. Okay, that's again something, unfortunately, that you do not, most of the time you don't have a say. Like, the client is either automatically placed, usually they're placed in a group, but they're automatically placed in a group or they're placed in an individual placement. Me as an administrator, I get to do that role. But when I was a music therapist working, right out of school, they were just placed like, hey, so-and-so is going to be in your Wednesday group because you have 3 other clients who are blind in that group. And it's like, all right. Like, you don't really have a say. So appropriateness for a group or individual placement, and formulate goals and objectives. Yeah, those, I'm sorry. Appropriateness for group and individual placement, frequency of session, and then goals and objectives. Those are the 3 areas that in the real world you will not, most of the time, not get a say in, okay? Just to let you know. So for the purpose of this exam, we get a say, which is pretty darn cool. So let me sum this up for you. For the exam, we have create, and I'm going to put create music therapy, goals and objectives that are 6 months long. And then, let's see, formulate goals and objectives. Frequency. Oh yeah, frequency of treatment for the sake of the exam, 1 time a week for 30 to 45 minutes. Okay, that's like, 45 is kind of pushing it, but if it's an older client, you can do 45. If it's a kid, it's 30. 1 time a week too. But it's always better to do more frequently, of course, just like practicing. More frequently for less time is more effective. Okay. Adapt. I'm going to say adapt materials and music as needed. Create a physical environment like I said, this is on the exam, and there's the two best ways to formulate a room for therapy is, of course, a circle slash, it's like a U shape. You guys have probably seen it if anybody was in a debate team or a discussion board. It's like a U-shaped classroom. That's always the best. Well, in the real world, that's the best way. U-shaped classroom. And then, of course, they talk about partitions on the exam. Like, should you be behind a partition, in front of a partition, blah, blah, blah. So if you have your group here, and then and you're taking like an individual out, you want to be on the side of the room, theoretically behind a partition, because like you don't want this person that's, you know, disrupting to be a pain. Okay, so that's like honestly best to just pull them to the side. So I would just say here, pulled to the side behind partition. I forget how they phrase it in the question, so I'm gonna have to go over that one in another video. I think it's like, I think this client is misbehaving, and then I think the question is that this client is misbehaving and you need to take them out, so you work with them behind the partition. I think that's what the question is, but I'm not like 100% sure. But when we go through the questions in a later episode, we'll get the scenario correct. But in the real world, yeah, you would work behind. Okay? So it is 22 minutes almost, and we spent the whole time on 2 sections, but these sections are just really important. Client assessment and treatment plan. So let me just sum this up for you. So obviously for assessment purposes, you want to try to incorporate accurately respond clients' responses. You want to record them accurately. You want to use every musical skill you got to pull some type of information out of that client. From this assessment, you're going to develop the goals and the objectives for the client. And then you're going to communicate that through writing most of the time. Sometimes, if you're lucky, you'll get to have a meeting with others. Okay, treatment plan for the clients. Of course, we want those. We want each goal to last for 6 months. And then you want like between 4 to 5 objectives per goal. So then that way you can hit each goal effectively in 6 months. You're going to pick a goal based on the assessment findings. In the real world, you will find new goals as you get to know this client. So I don't want you guys to think like, oh my God, what if I assess a client and they're perfect, except for their speech? And it's like, well, once you get to know them, you'll like, okay, maybe you start working with speech and then you notice that their gait's a little off. Okay, then you add it to the next goal. So yeah, you'll be able to formulate new goals and objectives to keep the therapy going. I don't think I ever needed to terminate somebody unless it was like a money insurance reason. Okay, moving on. We have adapt music, instruments, and equipment for the client's needs. Formulate if the client is in an individual or group setting, how long their treatment and their session should be. And then we want to determine appropriateness for music therapy and coordinate with other professionals. I'm going to leave you guys with coordinating with other professionals. That is the most important part of this whole thing, and that's going to be better for your clients. They're going to be able to reach their objectives so much faster if you like work with other disciplines. All right, so that's pretty much the sum of it. Again, remember that this is 20 questions, and then our next video is going to be on the implementation, and that's like the big kicker. That's the 63 question majority of the exam is on that. Okay, so Goodbye, everyone. Remember, we're saving the world. One note at a time. You guys got this. See you in the next video. Goodbye.